So you
Cool.
guys today are joining us, North Kansas City Hospital, with John McCurdy. He's from our sleep center, and he's going to be going over some sleep health and a little bit about sleep apnea as well. So this is a kind of an informal one, so you can ask any questions that you have in the Q&A or the chat function at any time, and we will answer them. We do need to let you know that this is being recorded, and we will have this on YouTube later for you to share with others. So, John, I'll hand it over to you.
Oh, hi. Hello, everybody. Thanks for joining us today. You said this is going to be on YouTube?
It is going to be on YouTube.
Oh, I'll be famous then.
You will.
I will be famous. That's cool. All righty. So, folks, today we're just going to hit a little bit information about sleep, about good sleep hygiene, about sleep apnea, and what that really is. Some treatment options, and then obviously anytime during this y'all have a question, just let Shauna know and I'll try to muddle my way through it as best I can with you. So the first off, I don't know if everybody knows that really the definition of sleep is, it's simple, but it can be kind of confounding. It's just that the state of sleep is where you are kind of disconnected from the surroundings, but you can be awakened either by an auditory response or a physical touch. And versus when somebody is under anesthesia, that would take a chemical agent to reverse the medication on board to allow the patient to wake up. During one's night's sleep, we'd like to see a patient that has what we call consolidated sleep. In other words, they're not awakening a whole lot of times. 5 to 8 times an hour is based on clinical data, is to be perceived as normal, okay? And these awakenings I'm talking about, I'm not talking about you're physically aware that you're awake or you're mentally aware that you're awake. It's just brief periods where your brain activity has changed in terms of the morphology of the brain waves and so forth, the amplitude and the frequency of the brain waves. We can tell immediately when a person is awake, and it only takes 3 seconds for an individual's brainwave pattern to change in a manner that would cause their brain to be awake. And it's this frequent awakenings with the brain that people are being subjected to, which causes the individual, if they have enough of them, to be tired the following day. All right, being tired the following day after a typical night's sleep usually is not what we want to see. Now, there are situations where that's not always going to apply, but if you're sleeping normally and you don't have a lot of issues going on in your life, and it's not a work-related problem or something like that, you should be sleeping pretty soundly. Otherwise, if you're not sleeping soundly and you wake up and boy, I've been awake a couple of hours and I could surely down and take a nap right now. If that's happening, that's not right. So that's when you should start investigating what's going on with you. All right. Now there's a number of sleep disorders that can cause that, but the purpose of this talk is we're going to target sleep apnea. It's very prevalent. It's more prevalent than what people really think. And the other interesting fact, along with not only sleep apnea, but overall sleep disorder statistics are kind of frightening. It's saying that 50 to 70 million of US adults have a sleep disorder. That's a lot of people. That's a lot of people. And these people that are out there that are sleepy, they don't know it, but they don't know what's going on. They know that they think this is normal for them, but it's not. It's not. And sleepiness has contributed to a lot of major issues. The space shuttle was contributed to lack of sleep by the technicians. The Valdez oil spill, that was contributed to somebody being asleep. So sleep is incredibly important to us. And it is a valued state that everybody needs, okay? So what is sleep apnea? Well, really simply stated, when you're sleeping at night and you're just cruising along sleeping, and then all of a sudden you kind of go one of those sounds, or a loud snoring sound, or you've been snoring and all of a sudden your bed partner doesn't hear you? That's probably some form of sleep apnea. And what it is, very simply, is the musculature in the back of our throats right here that normally hold our airways open, they lose muscle tone, either through excess tissue, like crowding the airways in, or through the nervous system not providing enough impulses to the muscles to maintain tone. So as these airways narrow, then the person's not getting enough air. You don't get enough air, you start having issues with your oxygenation dropping. And if that becomes to a point where your brain's going, whoa, we need to wake up, then that's where the arousal, what we call the arousal, awakens person, and it allows the airways to pop back open again, and the person breathes normally for a while, and then they go back to sleep, and there it happens again. This happens over and over and over and over all night long. The person's not aware of it. The bed partner might be aware of it, but the actual person sleeping has no idea. Has no idea. Along with the fatigue level that the sleep apnea causes, is I mentioned that your oxygenation level might be dropping. Well, lack of oxygen to our body, especially to our brain, to our heart, to our organ systems, over a period of time will take its toll. So people that have sleep apnea that haven't been treated for sleep apnea, they're the ones that we're seeing that have underlying heart disease, underlying diabetes. Those individuals probably have significant sleep apnea. Not only the diabetes and the heart issues, but the biggie is the incidence of stroke, sudden stroke. And it was reported several years ago that a hospital, and I can't remember the name of it, I'm sorry, but they ran a study on stroke patients that they admitted and found that 90% of them had some degree of sleep apnea. That's pretty high, and that's pretty scary. So when we talk to people, we really emphasize people that you need to get this treated. You need to get this treated, okay? Those are the physical issues that can occur in terms of your body system, but it also affects your mental capacity too. You start losing memory, short-term memory loss, long-term memory loss. It can even promote into having a person being subjected to anxiety attacks. Some people wake up at night, bolt straight out of bed, sit upright, and think they're going to die because they haven't been breathing. People who have been diagnosed with anxiety disorders, it makes that worse for them. So there's a lot of ramifications with sleep apnea that is occurring. So how can you tell, or how do you tell if you think you have sleep apnea? Well, first thing that we always target, and it doesn't necessarily mean that you have sleep apnea, is loud snoring. Loud snoring is problematic, not only to you, but to your bed partner, because it's keeping them awake as well. Now, not all sleep apnea patients have snoring issues. Don't misunderstand, but a great majority of them do. The sleepiness during the daytime, that can be problematic, very problematic actually. You could be falling asleep at work. You could be falling asleep after you come home and you're sitting there watching TV or reading or whatever, and you're nodding off in the chair. You could be falling asleep driving. It just takes a brief period of time for those eyes to close while you're rambling down the highway at 60 miles an hour for something tragic to happen. So those really are the biggies. And not only that, but interfering with your work if you're working. So your work productivity, which everybody likes to see in management, it drops off. So those are the biggies. Any questions from any of that so far?
I think we're good.
Cool. So how do you know, what are you going to do to see if you have sleep apnea? Well, you're going to see a doctor, okay? You're going to go to your primary care physician and say, I'm snoring, I'm tired, my mood has changed, I have headaches of a morning. And usually your spouse will, if you're married, the spouse will come with you and say, yep, he snores like a freight train, keeps me awake, he kicks, he flails, he jerks while he's sleeping. And that's going to be the key to the physician to say, you need a sleep study. Okay, that's good. So what does a sleep study entail? Well, there's two basic sleep studies. There's a home sleep study, and then there's the in-center sleep study where you actually go to a sleep lab through the hospital. The home sleep study is just really a very easy monitoring device that we set up on the patient, and it just monitors your heart rate, your oxygenation level and your breathing pattern. Those are very good, very, very good. There are some out there that aren't quite up to par, as they say. So if you are having a sleep study through a home study, you just want to ask the question, is this going to be interpreted by a sleep specialist, somebody who's board certified in sleep medicine, of which we have two doctors here on staff, Dr. Scott Shorten and Dr. Brian Ladisek. Both are board certified in sleep medicine. So that would be the first indicator for the home sleep studies. The other sleep study I was talking about, the lab study, is where you actually go and you're going to spend the night in the sleep lab, all right? Prior to going to that study, just so you know what's going on, here at our facility, we have what we call a clinic visit, and that we ask patients questions over their health, over their sleep habits. Are they having any issues during the day? We're going to look at their history and physical to see, yeah, they've got heart disease and so forth. And so we're going to tell the patient also what to expect during a sleep study, all right? And that itself is a whole different topic to cover. But as you are in the sleep lab, they're going to hook up various monitoring devices. They're going to monitor your brainwave activity, your breathing, your heart rate, and your heart rhythm, your oxygenation level. And we're also going to monitor if you're having any leg twitches at night. People have what's called periodic leg movement syndrome, and that's just where your legs kick for 1 or 2 seconds. You don't realize it, your bed partner might realize it, but when that does happen, it awakens you. So that is another issue so we're monitoring all that, and you get all wired up, and then you will be sleeping in a very comfortable room, and we just let you sleep, and then the next morning we awaken you. And most labs don't really have the ability to tell the patient what's going on with them right after the study. That is reserved for the physician to tell. Treatment options vary. There's positive airway pressure. There's oral dental appliances that you would seek through a dentist who is well-versed in oral appliances. And then there's position training, where if you're just having breathing events on your back, but you get on your side and you're fine, then we call those positional trainers. And we use either pillows to prop you up, or have you sew some tennis balls into a t-shirt at the base of the t-shirt. So when you do roll over and try to sleep on your back, well, you're going to wake up because those tennis balls aren't going to let you sleep on your back. So those are the options. The CPAP therapy, the positive airway pressure, is the most accurate and pretty well will cure the sleep apnea during the night. And what it is, very simply, is that there's a continuous flow of air from a little machine at the bedside, and it's connected by a length of tubing to a mask that you're going to wear. And all that device is doing is preventing those airways in the back of your throat from collapsing. You sleep better, you don't wake up, you sleep better because you're not waking up, your oxygenation level stays above 89%, and you won't feel tired the following day. That is really the nuts and bolts of CPAP. There's what we call BiPAP therapy, which is the difference is the air you breathe in, the pressure that you breathe in is greater than the pressure you exhale against. And that device we use for people who are just having very shallow breathing or just can't tolerate the pressure while they're on CPAP. And then there's also a device now where they can implant here like a pacemaker. And what it does, it sends impulses to the base of your tongue. It's a surgery procedure that you're going to have to go through to have that. And what it does is every time your tongue starts to prolapse, it zips out a little burst of voltage, and your tongue protrudes forward, and it works. It works pretty well, actually. So those are the main types of treatment for sleep apnea. The key thing, though, is if you have sleep apnea, you have a study, you're positive, you need to get it treated. You need to get it treated because it will not go away by itself. A lot of people think that, well, you're overweight, all I got to do is lose weight. That will help, sure. But there are many people who have what we call normal body habitus. They're not overweight for their height that have significant sleep apnea. So you can't really use that as an excuse or a method of trying to fix your sleep apnea. Wearing the positive airway pressure, using the dental device, the advanced mouthpieces, position training, all will work. It takes time to acclimate to these various treatments, because especially when you have to wear a mask over your nose at night, we're not used to that. Nobody wants to sleep with a mask on. But after you have worn it for a while, 2-3 months, you get used to it. It'll be just like automatic behavior. You're going to put that mask on like you do if you brush your teeth every night before you go to bed. So it becomes automatic behavior for you. What happens, though, to people that don't treat their sleep apnea? Well, they're going to get worse. They're going to be more fatigued during the day, and then they're going to start seeing issues with their heart. They'll start having rhythm disturbances. The normal sinus rhythm that our heart normally is goes into another rhythm disorder called atrial fibrillation, and that type of heart beat is not providing enough blood flow out of the heart to circulate through the body. And over a period of time, that's when heart failure comes into play, because the heart's just not strong enough to pump out blood for what you need. So the heart failure contributes to kidney failure. It also contributes to the poor memory loss, because your brain is not getting enough oxygen at night. And obviously the big one is over a period of time, depending on your brain, how it was developed in vitro. If you have any weaknesses in the arteries, over time, one of those has a great chance to just pop. And that's what a stroke is. So it's something that is not, take it serious. Take it very serious. Any questions? We got about 10 more minutes here. Is there anything you'd like me to hit on?
All right, John, let's see if we have any questions come in. John, did you cover what to look for? I know that there are some home sleep tests that we can do. Did you touch
Yes.
on what to look for whenever you're selecting which ones to do?
Sure. Our devices that we send out to people have a device that you wear on your nose. It's called nasal cannula. You'll wear a finger probe that measures your oxygenation level, and you'll have 2 belts, one around your thorax, one around your abdomen. Those are very comprehensive in terms of being able to rock solid determine that you have sleep apnea. Some of the other devices that are out there that are being used, they have this technology where they're measuring the peripheral artery tone in your finger and they're seeing that when the peripheral artery tone diminishes and then increases, well, that's an apneic event or a shallow breathing event. Some are better than others with that type of device. And then there's some that just have you wear something on your forehead and it'll be connected to a patch on your arm. I would definitely stay away from those. Definitely stay away. One important question you can ask, well, if you're not having a device in your nose with these, how is this measuring my breathing? You know, that would be a solid question to ask. And as I said before, who's going to be looking at this data, and is it going to be read by a board certified sleep specialist? Those are two big keys right there for you. All right. But and I'm not saying that they're not valid. There are some good ones. Dentists we get orders from dental offices on patients that they see, and a lot of dental offices right now are using home studies. So a dentist can prescribe for a home study and prescribe the therapy that the board certified sleep specialist tells the dentist what would be the best approach. Okay, so that covers the home studies issue. One thing that we're seeing with home studies is with the insurance regulations now, most insurance carriers now, private and Medicare, they want to see a home study first before they send that patient to the sleep lab. So more than likely, if you are going to have a sleep study, it could very well possibly be that you're going to have a home study first, and then if you're positive for sleep apnea, then you will be asked to have a sleep study during the night or your normal sleep hours at a sleep center, where we can get more detailed information and then possibly treat your apnea that night. Okay. Shauna, was that adequate?
Yeah, that was very good. Thank you. Thank you. John, I know that there's some things that we can do to kind of make our sleep a little bit better. Like some of the things that I've heard are, you know, what is it? No blue light for a certain time frame. Do you have any recommendations?
Light, that is something that I'm really not up to speed on, to be quite honest. But the blue light does cause penetration through your eyelids here at night, and it doesn't really allow you to get deep sleep. If you want to try the light therapy, a green light, a real low lux green light would be far more advantageous to a blue light, right? There's also, you can use, we'll talk about sleep hygiene here in a little bit. We'll just do it right now. You know, the old adage, go to bed every night at the same time, get up every day at the same time. Except on weekends, you can allow yourself to sleep in on weekends a bit. Napping during the day, naps are fine, just don't make it longer than 20 minutes. Anything longer than 20 minutes, you start impinging on changing your sleep time at night, by pushing it back farther in the night to fall asleep. The bedroom, you want to have a nice, dark, cool environment, and you don't want to be doing your work in bed. We also frown on watching TV, but I know from personal experience with my wife, she has to have that TV on so she can fall asleep. It relaxes her, which is fine. Just set a sleep timer on the TV so that it shuts off in 30 minutes, because she'll be asleep in 30 minutes. So 30 minutes is a nice cutoff for the TV. Don't exercise 3 hours prior to trying to go to sleep. Limit your caffeine consumption past 6 o'clock in the evening. Limit your alcohol intake after 6 p.m. of an evening, or we should say 4 to 5 hours before you try to fall asleep, because there are people that sleep during the day and they work at night. So everything is reversed for them. But those are the big ones, really. Of course, to promote good sleep, exercise, walking daily would be good. But if you can keep a routine about going to bed at the same time, getting up at the same time, keeping your bedroom just limited to sleep and intimacy, that will help a great deal. And then obviously, if you don't have sleep apnea and you still are having sleeping issues, you might have insomnia, which is either the ability not to fall asleep in a timely manner, or once you fall asleep, you wake up and you can't fall back asleep. And insomnia is a big one, and that's usually treated with medications by the physician and or cognitive behavior therapy, where they work with you to eliminate thinking so much, for the lack of better terms. Okay.
That was perfect. Perfect. Okay. Well, John, I think that wraps it up. I really appreciate you talking today.
Oh, thank you.
got some
I've
good
been
tips.
very, very, very thankful that you asked us to inform the public.
Absolutely. Okay, so just to clarify, how many sleep centers does North Kansas City Hospital have, John?
We have one sleep center. It is located on Green Hills Road, North Green Hills Road, which is off of Northwest Berry and close to 152 Highway. When COVID struck, we did have a lab in the hospital, but when COVID struck, that pretty well eliminated that lab. So we had the lab up here already. So all of the sleep studies through North Kansas City is done off-site here at Green Hills, and rooms are very comfortable. So we can get your sleep study done pretty quick.
Very cool. Okay, now do they need to go to a physician to get a referral?
Yes, you have to have a face-to-face visit with the physician. And the physician has to document the necessity for the sleep study, either saying that loud snoring, excessive sleepiness during the daytime, witnessed apnea. That has to be in their history and physical that is sent to our scheduling department. And the reason that is necessary is that if that's not stated, insurance will not cover the costs of the study. So those are the big ones. Any physician can order a sleep study through us. It does not have to be a North Kansas City physician. So we're more than happy to help you with that if that needs to be done.
Okay, perfect. All right, John. Well, that covers everything that I have. I look forward to figuring out what we can talk about next and doing it.
Oh, glad to help you. Anytime.
All right. Have a good day.
You be safe. Bye all. Be safe.
Bye.